Welcome to Moving Conversations, a podcast for movement professionals by movement professionals. If you coach, train, or teach movement, Pilates, or fitness, then this podcast is for you. With more than 60 years of experience in fitness and Pilates, your hosts, Brian Ritchie and Nora St. John, explore the science of human movement, diving deep into the facts, myths, and common misconceptions, hoping to spark thought and conversation about how we view fitness and movement. Now, let's jump into Moving Conversations. And welcome to another edition of Moving Conversations. I'm Brian Ritchie.
And I'm Nora St. John.
And today, we are going to be talking about a subject near and dear to my heart. It's something that I even wrote a book about. It's all about low back pain. So what we're going to talk about today is primarily going to be non-specific low back pain, generalized low back pain, some people call it. And it's what most people probably think of when they have low back pain. We're not going to be talking about conditions. We're not going to get into herniations or spondylolisthesis or stenosis yet. That's down the road. We'll cover that at a future episode. But today it's generalized low back pain.
Now, one of the things that we like to talk about is it's called non-specific low back pain. So if you have, for example, a client or a student who comes to you and says, oh, I have low back pain. And you say, well, is there any particular pathology or issue going on? They say, no, my doctor just says I have non-specific low back pain. What exactly does that tell you?
It didn't tell you anything. It just tells you it hurts.
Exactly.
Yeah, that's the thing about low back pain. I can't tell you how many times I've had clients come into me, and that's exactly what they'll say. I do a medical history on everybody that comes in, and they'll say, yeah, I've got low back pain. I say, okay, what's the condition? And they go, what do you mean? Well, did you have an MRI? Did you have x-rays? Have you had anything? Oh, yeah, but I don't remember. Or, no, the doctor just said I have low back pain. Or the classic, I have sciatica. And it's like, okay, we need to dive a little bit deeper, because if it is just generalized low back pain, what you're telling me is it hurts. And we got to figure out, we have to sort of be body detectives here ourselves and try and figure out, well, what could be the possible cause? So after things have calmed down and hopefully they've gone through their therapy or medication or whatever. But yeah, now it's the time for us to figure out, okay, what should we do about it to help?
And one of the things that I like to add with that, Brian, is when somebody says they have non-specific low back pain, or they just have low back pain, which often is all you'll get, it doesn't always mean there isn't a condition underlying that.
Absolutely. It
often just means that path has not been explored. They haven't had an MRI. They haven't had whatever other tests might show some specific pathologies. So all we really know is they have low back pain.
Yep.
Now, if that's all that's given to us, then really, I love the idea of the body detective, which is exactly what we have to become. It's our job to try to figure out what they're doing or how they're holding themselves or what they're strong or weak or mobile or not mobile in that may be leading to stress in the low back.
Absolutely. And what I always try and start, one of the questions I ask immediately is, what makes it feel worse? Mm-hmm. Is it sitting down, standing up? Is it standing for long periods of time? Is it walking? Is it sitting? Because that's going to tell us about position. And we're going to talk about position in a little while. But that's one of the first things that sort of gives me an indication that, is it positional? Is it something where, oh, every time I sit down, it feels so good, but I stand up and it's killing me? All right, that may tell me a little bit more. And okay, let's take a look at how we're standing or how we're sitting or all of those kind of things. So for us, position and talking about what position might feel good is always good to know. The other thing that I usually ask is, when does it bother you? Because for some, and I'm sure you've seen this a lot, it's more of an endurance, or we call tissue tolerance, where they're fine, they wake up, very little pain, they're going through the day, very little pain, and about 1 or 2 o'clock in the afternoon, their back is killing them. And it's like, okay, so it may just be a strengthening issue that they don't have the strength to sit at a desk, with decent posture for a long period of time.
So what I like about that is you brought up two things. So one is position, right? Alignment, posture, all that stuff, and how you, again, try to figure out what the problems are. And the second thing is that idea of is it a strength issue? Is it an endurance issue, right? So we're looking at alignment. We're also looking at kind of strength and the ability to hold a position for a period of time.
Yep.
The third thing I like to mention in those is, are they more sore when they haven't done anything, like first thing out of bed, first thing standing up? If they've been sitting for a long time, they're sore when they stand up. Is it from inactivity or is it from activity? Right? Because the other thing is, like, if they, I only hurt after I run for X period of time.
Yep.
Or I only hurt at my, fourth mile on my bike ride. That's a different thing. Or I'm always sore in the morning. Once I move, I feel better.
Exactly.
That's going to tell me a little bit too, right?
Absolutely. Absolutely. I mean, the thing that we always joke about is motion is lotion. A lot of people just need to move more. So if they do start moving more, they wake up and, they're so stiff and, they're moving really slow. And I'll be honest, I'm 51. I'm going to be 52 in, a few weeks. And I get up in the morning and it's like, I'm moving slow and I feel like, this old man. And by the time I get to the bathroom, I'm standing up tall, I'm ready to go. But, those first few steps, are a little rougher. Motion, we don't move all night. So by getting up and moving more, we can really affect a change in our clients' posture. And how many of them, let's face it, especially with Zooms and all of this kind of stuff. And just so our listeners understand this, Nora and I are talking across country on basically Zoom. So for us, this is how a lot of our clients spend the entire day, sitting, looking at a computer, looking at a screen, and they don't move. So absolutely, bringing up the fact that, does it feel better when they move? It tells us so much.
So this brings us back to that idea of, like, our job is the body detective. We've really got to figure out what's going to make them work. Now, one of the things I want to say about that, though, is one of the things that a lot of research has shown is that one of the most effective ways to deal with a lot of non-specific low back pain is movement.
Yes.
Appropriate movement. Like that, there's many, many studies that say, like, you can do hands-on work, you can do medication, you can do other kinds of, like, PT-oriented treatments. And all of them really come down to the most effective thing is changing posture, changing habit, changing strength, changing mobility, movement. In other words, all the things that we do.
And I want to go back just a little bit before we get into the specifics. Just so people who are listening, they may be wondering, I've never had back pain, or, I know a couple people with back pain. Something that most people don't realize is 4 out of 5 people are going to have back pain sometime in their life. Well over 80% of people, especially United States, are going to have low back pain. That's a huge number. And if you're working with a client who has low back pain, or just look around, 4 out of 5 of your clients are probably going to have low back pain sometime in their life. And it's our job to get them to move better. It's our job to get them to become stronger and not to make this situation any worse. So we really have to sort of keep that a little bit in the back of our head, that if they have had it in the past, okay, what could have caused it? What might have led to it? How often do they have these spells? There are some people who are going to come to us who have it now, who are very in a subacute state, not acute, but subacute, that it's recurring, it's happening on a regular basis with a certain amount of frequency. And that's who usually winds up coming through my door, maybe not through the average gym, but at least in my practice and in your practice, those are people that we see often. So these are people that we have to realize that, like I say, 80% of people, and it's one of the biggest disabilities worldwide that there is, you know? Second reason to go to the emergency room or the doctor to the common cold or the flu. So, that's huge.
It's huge. And we look at disability due to low back pain is as much as 10% of the population worldwide.
Yep.
That's disability. And then, chronic low back pain can be as much as 25% of the population, which means pain greater than 3 months of duration.
Absolutely.
So you're going to see this. We all see this. And this is very common. Either you've experienced or a relative or a friend, and certainly clients will come in with some version of this at some point.
So when the client comes to you first, okay, and says they want to work with you, they have low back pain, or even a client that has been working with you and suddenly develops low back pain, what's one of the first things that you're going to do with that person? What are you going to take a look at?
When somebody comes with low back pain, I really start my assessment the moment they walk in the door.
Yes.
So I look at how they're moving. Are they comfortable sitting down and taking their shoes off? How do they sit in the chair across from me if we're looking at each other across a desk? How do they get up out of that chair? Can they bend over? Can they not bend over? So I just start with just basic, like, how much pain do they look like they're in doing ordinary things? That's sort of my first step. And then from that, it's just refining that. Well, how are they moving? What is their posture like? They have a lot of low back lordosis or a lot of kyphosis. And then we just go on from there. It's really looking at how they're moving and how they're holding themselves.
I like that you said that, because how many times have you had a client come into you who says, my back is killing me today? And you say, okay, and then they just pop up out of the chair and move like there's nothing wrong. Now, there are people who have relatively high tolerance for pain. I herniated 2 discs when I was in my 20s, and it's something I've dealt with my whole life. So for me, I can pretty much fake it if I need to. It's there. I feel it. But when it's debilitating and I'm in a lot of pain, I can't fake it. So it's true, when the client is in front of you, how they move is going to say way more to us than what comes out of their mouth.
Yes, it's don't just listen to what they say, but listen to what they do. I remember one client that I had specifically who came in and said, I want to work on low back pain. And I said, well, tell me about when you had low back pain. And they said, well, my back went out 6 months ago. And I said, okay. And are you in pain now? It's like, no. Have you had any pain since then? No. Like none at all? Like less than I have on a daily basis? Says, no, none at all. I said, okay. So really, this person did not have low back pain at that time.
Yep.
But they still had in their mind that they had low back pain. Therefore, they were a low back pain patient.
Yep.
And so, that was just good to know. It's like, okay, so you have an idea about your condition that isn't actually accurate at this time. But I still wanted to look at like, okay, so maybe why did that happen 6 months ago? Same process. What's your posture? What are you doing? Where's your strengths and weaknesses? Where's your mobility and your stability? And we move on from there.
Yeah, watching a client when they walk through the door is one of the best ways I find to really initiate my assessment, because I will walk out of my office, I'll greet them, hi, how you doing, and I'll watch them get out of the chair. I'll watch how they move. I'll watch when they sit. Do they lean to one side? Are they avoiding a certain posture? You're watching all of these things, and when they get up, can they do so without using their hands? Or one of the telltale signs for me, for anybody who has low back problems, and usually I get it over the phone a little bit, they'll, give me a hint of why they're coming to see me, is do they sit down to fill out the paperwork, or do they stand up?
Yep, exactly. I was just going to say that. If they don't look like they want to sit down, and they kind of look at your chair with dread, then it's like, okay, that's another good sign that maybe sitting is not their favorite position, right?
Exactly. And then it's watching them walk. Physical therapists clued me into this. And one of the most simple ways is, do they have any thoracic rotation when they walk? Or are they walking robotically? Yeah. If they walk very stiff and they don't swing their arms much, or if they're swinging it's from the elbows, their shoulders don't move, their spine is basically a rod from their neck all the way down to their tailbone, then it's like, wow, they don't really move much. So in this instance, we may say, oh, you just need to get your body to actually move, and just swing those arms a little bit, or just allow some motion to occur. And that can definitely begin to change how their body feels.
It's also just a sign that they're bracing, right? It's a sign that they're
Guarding.
holding themselves steady. They're afraid they're going to be in pain.
Mm-hmm.
And if any of you out there have been in pain, which probably some of you have had low back pain in the past, that would be common. That feeling like, oh, I don't want to move because I'm afraid I'll hurt something.
Yep.
Right? So exactly, you want to just notice that. It's a very quick sign to notice, and then see if you can have them move and what happens. Because a lot of times they've just stopped moving without really understanding if it makes them feel worse or not when they move. They're just scared.
Yep. And I don't know if you've said this, I've said it a million times. When you can see on their face scrunches up in their eyes, and they're doing a certain move and everything. And I just say, does this hurt? No. I say, well, tell your face. And it makes them giggle or laugh and things, and they, oh, okay. And I'm like, you're looking like you're constipated, or that. I said, I understand. You're expecting pain. I get it. Relax. I promise you can yell all you want. If it hurts, yell at me. But if it doesn't, trust that things are going to be okay, that you are allowed to move, that your body was meant to move. Maybe not through huge, great ranges of motion. Let's explore that a little bit. Let's, figure out what ranges of motion work. But let's see, can you move? And I'd say 95% of the time, it's no problem. And if they are in the middle of spasms, well, guess what? They shouldn't be seeing us right now to begin with. That's when they should be seeing the doctor, physical therapist. That's way beyond our scope of practice when they're in such an acute situation. Chronic, yes, we can work with. But if they're that acute, no, that's not, you shouldn't be coming to see us.
Yeah, it's not our time. So it's outside of our scope of practice. It's not our time. Movement is not appropriate in that really, really acute stage, or may not be.
May not be. Yeah.
And again, with a lot of experience, you really don't want to be addressing something when it's in that state. That's not your job.
Yeah, it needs to calm down first. When it's in such an inflammatory state, we need to get it to calm down. And again, that's the doctor's job. If they come to us after that, great, things have calmed down. It's now our job to get them to move. And I'm very big on stabilization. So for me, it's like, okay, we want to stabilize certain things and move certain things. What should move and what should remain a little bit more under control. And once we get to them to feel that, they're like, oh, okay, I can move. I can move this. I can move that. So when you're doing your assessment with someone and you've watched them walk through the door, stand up, sit down, all of that kind of stuff, what is your next step? What would you do for this person?
Well, taking it a step before working on their stability, a lot of it is understanding what they can tolerate and what they can't. Mm-hmm. So if, for example, somebody says, I really can't sit. I can't sit anymore. After about an hour, my back is killing me. I now have a stand-up desk, so I go back and forth, but I really can only tolerate sitting for 45 minutes. That's going to tell me something. That's going to tell me basically that most likely they're having trouble with flexion. Yep. Because when most people sit, they posteriorly tilt their pelvis, they kind of roll their spine back, they stretch out their lower back, and they kind of hunch into the chair. So that tells me that that's possibly where some of their trouble is coming from. If, on the other hand, I've got somebody who's standing all day, that's their job, or that's what they do, and they're on a hard surface, like maybe they're working in a warehouse, it's a concrete floor, and their back gets really, really sore and standing, then I'm going to say, okay, maybe number one, tissue tolerance. Yep. They don't have the endurance to hold that position in a good way, and possibly they're getting some compression in the low back, and possibly they're getting pushed a little bit into maybe lordosis, or at least a little compression at lumbar. So those are just things that help me understand, like, am I going to start with trying to create more space in the low back, maybe focusing on some flexibility, some flexion, or am I going to really avoid flexion and focus on some strength, some extension, and working really on neutral and stability? So it just gives me like a couple pathways to follow.
And I think that's the best way to look at it. When I say to a client, tell me what causes increased pain. And you do hear something about, okay, standing. Okay, their back is probably going into extension, especially people who have a larger belly or they lock their knees or anything like that. They're going to compress their spine a little bit more and be more in a lordosis, a little bit larger arch to their back. So for those clients, you could say, okay, that's what hurts. So let's work on a little bit more flexion. A flexed position feels better. So I may start them, in more flexion, and vice versa. If someone feels better in an extended posture, I'm going to keep them there with the goal, hopefully, to move more toward, a normal, quote unquote, neutral situation. Now, again, I'm going to say this, and we'll probably say it a number of times, because anytime we hear, oh, someone feels better in this posture, there could be something bigger in underlying the situation. There could be a medical condition of some sort. Not saying it's a death sentence. That's the one thing I need people to realize, is that just because you've been diagnosed with something doesn't mean it's a death sentence. All it means is, okay, something's happened in your back and now we have to manage that condition. And it's okay. We're going to do that through movement and through exercise. Nothing wrong with that. But it gives us an idea of, oh, there might be something else going on here. Okay. And something that we're going to probably repeat over and over again during this podcast, not just today, but for future, is when in doubt, refer out.
Yeah, absolutely.
If you're not sure, refer to a physician so you do have greater information, because Nora's going to tell you, I'm a scientist by nature. I like information. I like to know what's going on, because that will help me help you, the client, do better. It gives me that bullseye. It basically takes, like I'm throwing darts at a dartboard with, behind my back, my eyes closed. That's what it can feel like at the beginning. But as soon as you have more information, now I can see the dartboard. Now I can actually aim. And now I can, okay, here's what we're aiming for. So it can help me narrow my focus a little bit. So I know exactly what I'm doing with that client instead of just saying, well, let's try this. So sometimes referring out can be our best bet. But for that client with that nonspecific low back pain, supposedly nonspecific, and we have now figured out what works best for them, would you start them in standing, seated, lying? What position do you find would be the best?
So my general progression is I need to teach a client, or how I typically start teaching a client is I'm trying to figure out what their best lumbopelvic position is, what causes the least discomfort, and what position I'm going to sort of train for them to be able to hold for longer periods of time to decrease their discomfort. So that's definitely their lumbopelvic position, where their low back is, where their pelvis is, whether that's painful or not is like a place that I start. So two ways to start with that. I'm thinking of one client. I'm going to use an odd example and then my usual path. This one client had trouble every time she stood for a long period of time. And she was, she was the head of a company and she did a lot of social events and she had to stand a lot at these social events. And her back would always hurt after about 10 or 15 minutes and she would just bear it until time went on. So for her specifically, I looked at her posture and her standing posture. And when she stood, her tailbone was tucked under, her knees were kind of locked, and her back was really in a flat back position. It was a little bit flexed just in standing. Her shoulders were a little bit hunched, and that's how she stood. Now, in her case, I gave her the clue of, I said, okay, so what I want you to do next time you're at a party, which was like 3 nights from then, I said, I want you to stand, but stick your butt out. Like literally let your low back come into a little bit of a curve and just change your standing position. She came back to me like the next week. She's like, oh yeah, I could stand for like 45 minutes. It was no problem. So that was an unusual situation where there was an obvious postural thing. I made a small postural adjustment that solved the problem. She was then able to just change her position that way. For most clients, it's not that clear. Right? For most clients, they have no idea what position is going to work. They just know that this hurts when they do this and it hurts when they do that, and they're in pain all the time and they don't know what to do.
Yep.
So then I typically take them down into either a supine or an all fours position because that takes gravity out of the picture. It allows them to focus on fewer things at a time. When you're standing, there's a lot of things to think about. When you're lying down, gravity is taking care of a lot of it, and the ground is supporting you in a lot of ways. So really that first step is trying to figure out what position works best from either supine or all fours is typically where I start.
Yeah, I'm very similar. How I sort of see it is when you're on your back especially, there's so much contact with the ground, so much surface area that surface area is really going to stabilize you. You don't have to do nearly as much stabilizing of the rest of your body. Whereas if you're seated, well, I still, even if my feet are planted on the floor and I've got this big cushy seat like I am right now, but I still have to stabilize from my waist up. If I'm standing, I have to stabilize from the ground up. So the closer you get to a standing position and then, vary the foot position, all of this creates greater instability. But if you are on your back, lying down, you are pretty stable. When you're on all fours, technically it's 6 because your toes are touching as well. You really have a lot of stability there, greater than if you were kneeling, which changes it, or seated or standing. So that's exactly how I start most of my people, if they can tolerate it. I just recently had a client come in who had severe vertigo, and it immediately made me go, oh, well, I got to find another position for this person, because if I take them off, their natural vertical plane and put them more horizontal, I'm going to possibly cause a little bit of disruption to that. So it made me need to change my thought. But in general, I like starting people on their back. I feel that they can feel things better. If I want them to be in a flat back position or a flexed posture, they can feel them pushing themselves into the ground. Or if I have them put a hand under their back, they can feel themselves pushing it back. Standing, well, they can't really tell necessarily unless they're looking in a mirror. It's harder to tell for some people. So feedback-wise, they're going to get it.
You have less proprioception, right? Proprioception means knowing where you are in space and what your body's doing.
Yep.
So if you're supine and you're lying on something, you've got pressure on your butt, you've got pressure on your back, you've got pressure on your arms, your head is supported, your feet are on the floor. So you've got all those points of contact that let you know what your position is.
Yep.
You can feel, for example, if you tuck your tail in that position, that your back moves closer to the mat.
Yep.
Right. And if you move your tailbone closer to the table and arch your back, you'll feel your back comes up off the mat. It also just decreases resistance, decreases force, decreases load, decreases all those things.
Yep. And
so
gravity.
Increases the ability of feedback and awareness, and takes gravity in a different plane.
Exactly. It takes gravity out of it. So gravity can actually assist in that sense. So yeah. Very good. Very good. And then would you take them from that flat back position onto all fours next normally if you were going to sort of, let's talk about progression. They've mastered lying down. The thing that I've noticed, and tell me if this is true for you, again, Pilates land versus fitness land, is if I have someone lying on their back and I can get their core engaged, I can do a lot of things and really get their core engaged. You change their position and suddenly gravity's pulling from a different way, and now their core can't feel it and they can't get engaged. They're like, well, why can't I can't feel it now, especially when they stand up and suddenly they have no core and they can't engage. So I think we need to challenge in all the different positions, but we need that progression to make them successful and for them to be able to feel that. So oftentimes
Absolutely.
I'll take them onto all fours next just because we still have gravity, helping. We have a lot of surface, contact, and that does help. Do you find the same?
Absolutely, yeah. Because from all fours, you've essentially, to some extent, taken the upper body and the lower body out of the equation, right? Let's say you're doing like cat-cow, or you're just doing some simple spinal motion, and you're not doing a lot, right? You've stabilized the upper and the lower. The upper body and the lower body are kind of relatively stable because the knees and the hands are on the ground. You can just feel the movement of the spine. Gravity is not going through the body in the way it is in standing. It's going more front to back. And it's very easy, I find, for clients to move their spine comfortably in that position. Because it also helps me to really understand what their limits are in terms of spinal mobility, because you have relative spinal freedom there, both in flexion and extension, like in a cat-cow kind of exercise. Even in rotation, right? You've got at least torso rotation, not whole body rotation. And you've got ways to assess and analyze and understand that in a position that is generally comfortable for the client. So they get mobility and you get awareness, and they also get some awareness about what's moving and what's not moving.
I like that thought that you said, because when they are in the hands and knees position, we can get them to mobilize a lot differently than even on our back. Because if you have someone who is, let's say, 220 pounds, which is an unlikely now for a lot of men in America, and you try and get them to do any type of flexion, you try and get them to do any type of curling, waist curl, sit up, crunch, whatever you want to call it, that's a lot of force on the lumbar spine. That can be a lot for someone like that, but we still want to train flexion. But if you put them on their hands and knees, suddenly it's unweighted. It's unloaded, not unweighted, it's unloaded. So they can do that cat and cow, cat and camel position, get that flexion and extension in a way that's gentle on the body. So we can get some mobility there, because let's face it, most men have a tendency to be a little bit more fixed in that area, a little bit more, rigid, inflexible. So we can get that in an unloaded position rather than trying to do it in loaded.
Absolutely. And I find too that, again, depending on the client, you want to work mobility and stability. The other thing too you can work with there is, we call the bird dog position, or the opposite arm and leg reach position, or even just lifting a hand off the mat or reaching a leg back behind you, where you're challenging the ability to hold that body in one place.
Yep.
And there's lots of ways to increase proprioception there, putting a dowel from the head to the tail, or a foam roller, and holding that there and making sure that it doesn't roll off when they move their arms or their legs. But just ways for them to feel like, again, in that relatively unloaded position, they can find support for a neutral lumbopelvic position and for a neutral spinal position.
Absolutely. And it begins to teach whether you want hip extension or shoulder extension, or my thing is always this: if I'm on my hands and knees, I've basically got 4 main points of contact. I'm not going to count the feet for a second. I got 4 main points of contact. Well, if I do, I'll usually start with an opposite elbow touch where they take one hand and maybe de-weight it first to make sure that they have some stability. But when they lift it up and touch the opposite elbow, well, their center of gravity has changed. Their spine now has to adjust, and it's going to get stronger. Even if it feels relatively easy to maintain that position, doing 10 or 15 repetitions, suddenly they're getting tired in their low back. Same with hip extension. You have them take one leg and just a foot slide. Just slide that foot back. I have furniture movers that I use sometimes, and just have them slide their foot back so they're going into hip extension. And maybe we can maintain that neutral pelvis when they're doing that. So we're working now the hip joint. We're getting the glutes engaged. We're keeping that spine stable and not letting it move all over the place. So these are very gentle ways that we can begin to get them to move in that plane before we ever ask them to do something like a squat or a lunge or something that's going to be a lot more dynamic, that's going to be a lot more challenging.
Right. So we start with small moves. We start with relatively isolated areas of the body working as opposed to whole body working together. We start with, again, awareness. I always find like the key thing for low back is you've got to educate your client and help, actually not educate them, I would say work with them to help them understand what their best position is in terms of pain relief and comfort, and then train them within that. And that's always a process. But the more you can really tune them into what's happening in their body, are they maintaining stability? Are they more comfortable here? Are they more comfortable there?
Yep.
Through simple exercises like supine and all fours, you come to the end of that, it's like, oh, I feel much better when I'm in this position. It's like, okay, let's now work on that in sitting, in standing, in a squat, in more complicated moves.
I love the thought that you say about awareness, okay, because most people don't know where their body is in space.
Nope.
You know, yes, they could tell you, I could close your eyes, touch your nose. They can do that. They understand proprioception. They know where their body is, but they really don't know where their body is. So you ask them to become more aware, and they really don't know. An exercise I'll have them do is lie on their back and slowly take one knee out to the side. You know, just a little bit of a knee drop to the side, and suddenly their pelvis is rolling and they're rolling their whole body over. And I say, well, don't do that. And they say, I am? I'm like, you can't feel this. They lack that body awareness, you know, and it's sort of like, oh, okay, we have to reteach that. And part of it is, like you said, about awareness. Just where is your body in space? How does it feel? Can you feel where it is? And starting them lying down where they have the most proprioception is perfect. Then hands and knees where it's unloaded is great before we ever try to get them in an upright position, which can be a lot more challenging.
Absolutely. And you have very little awareness in standing. I mean, it's kind of like with my one client, you know, that I mentioned as my first little case study there that I discussed, where all it really took was a change in her position, and it was just habit, right? We choose a position out of habit. We sit a certain way, we stand a certain way, we do our dishes a certain way, whatever it is we're doing, you drive with a certain, you know, posture. And oftentimes that's the problem. It's just that we're doing something for 8 hours a day or 6 hours a day or an hour and a half drive or whatever it is. And it's become habituated to it. We become used to the pain and the discomfort, and we don't actually make the choice in our mind to go, what would happen if I changed my position on my sit bones? If I leaned to my right side, if I, you know, put both hands on the steering wheel? We don't actually take the time to even become aware of the pain and then go, is there something I can do in this moment to change it? Right? Because once a client gets that empowerment, it's like, oh, well, I know when I sit in my office chair, by about hour 3, I'm totally sore in my low back, and I realize I'm completely rolled back into my chair.
Yep.
Okay, so now I know that to change that, I've got to come up and sit up on my sit bones, even if that lasts for 5 minutes, and then I roll back. And then I sit back for 5 more minutes, and then I roll back. Like slowly making those habit changes, because that's where so much low back pain comes from, is habitual posture and movement patterns.
Absolutely. And what you just said about driving, we all drive for a period of time. I drive probably an hour and 20 minutes every day to and from work. So for me, I'm even going through it in my own head right now. what is the position of my leg when I'm working the accelerator? Because I'm on a main thoroughfare for the most part. I'm not hitting my brakes too much. So my leg is externally rotated. I'm mainly working just my ankle joint. My leg is sort of against the console, just sort of relaxed, but I'm definitely externally rotated. So in that position, what's happening in the hip? Well, my piriformis is probably a little shortened. I may be, there's all these things that can occur that if me, who's a fitness professional and very body aware, I'm thinking, wow, I don't even know, I'm not even aware of it in the moment. So can you imagine our clients who have no idea where their body is? And if you ask them in their car, where are you seated? Are you seated straight up? Are you leaning back? Are you leaning on one cheek? Are you doing this? What's one arm doing? Are you driving with one arm? Are you driving with both arms? They'd be like, I don't know. They've never been asked these questions before.
Right.
So these are all wonderful things to get that awareness to them, because then they can tell us and we can begin to make subtle changes or build the strength and endurance that's going to assist them to be able to sustain if they need to, like the factory worker or someone who's standing all day long. Well, you know what? It's not like you're going to not stand. So we need to strengthen that.
Yeah, exactly.
We can teach you to stand better, and we're going to work on that awareness. So that's a perfect place to start with this. And then really working on position and finding the right position, especially as they come off of the ground in a seated position or a standing position, trying to figure out, okay, what position does work best? And, let's just go into seated. For teaching a client how to sit properly can be very challenging.
And exhausting. I know I've trained a lot of clients with that, because honestly, to be able to afford us, they often have to have a job, and it often involves sitting, right? And what I find, even for myself, that I can hold a better posture for a period of time. And I know when I was first training, there's one client who really was very slumped. She just absolutely slumped every time I'd sit her at my desk and she would just go into a complete slump over the computer keyboard. And so I had to try to sit up straight, just simple sit up straight. She could tolerate it for about literally 2 minutes, 2-3 minutes, and then she'd slump again. And then it's okay, that's fine. I just want you to do that 4 times an hour for 2 minutes. Sit up straight, and then she'll just forget about it. And then come back, sit up straight, just set a little timer on her computer, come back. So, da-da. And over time, she could increase that endurance of that posture. And then we also did, things in the studio and stuff to strengthen the upper back and just to work on that. But she really did need the training in the actual activity.
Mm-hmm. Absolutely.
And we had to figure out a way to do that.
And it comes back to that tissue tolerance, building muscular endurance. Because again, we're not talking specific exercises today. We're really talking much more about awareness and positional awareness. And that alone can solve a lot of people's low back problems. Because again, by getting them stronger in a proper position, and we're not going to talk ergonomics because there's a lot of arguments on both sides, but just getting them to sit up straight for, like you said, a minute or two. Doesn't have to be long, just a minute or two, and then relax. It's sort of like when you and I have talked about, if you want to, get someone to be able to walk farther. Okay, you're going to walk down the block and back. That's it for today. Then maybe go one more telephone pole the next time. Then one more telephone pole the next time. It's building up that endurance. So when they're sitting there in their chair and they can sit there for 2 minutes today, and next week we add 3 minutes. And then maybe keep moving that up a little bit until it becomes habit.
Yeah.
Until they're doing that more than, and they're doing that more. And then, yes, after half an hour, maybe they start slumping, but they were in good posture for 30 minutes or decent posture. I don't know about you, but I've found even myself, the more zooming we do, the more I start leaning in toward the camera. And I was actually working on a presentation for one of our conferences on posture. And I can't tell you how many times I kept correcting my own posture because I'd start leaning in, looking at the computer. I'm like, man, I got to put on my glasses because I'm trying to see better. So I'm leaning in and I'm like, sit up straight. You're writing about this. You're literally writing about bad posture and you're exhibiting it. So it's really about that awareness and making it constant so that we can make that, extend. So we can take that endurance and make it 3 minutes, 4 minutes, 5 minutes, 10 minutes, 20 minutes. Because believe it or not, by doing that, that client that has back pain right after lunch every day or at 2 o'clock, suddenly their back pain doesn't come until 4 o'clock or 5 o'clock, or they don't notice it until they're on their way home. And like, oh my gosh, it didn't bother me at all today. Because we're finding the right position, we're beginning to build strength, we're beginning to build endurance, and it does seem to help. It does help them.
That's really our role in low back pain, is helping them find a movement pattern that works, finding ways to stand, sit, walk, whatever they need to do in their life, in ways that are just more effective, more efficient, and less painful. That's our role, and it's a very important role, specifically in low back pain.
Yep.
Because that really often is the answer. It's like, at least my opinion is, a lot of like just painkillers are not going to solve the problem for the most part. If there's an acute inflammatory situation, it may take care of that. But if the underlying condition is that they're not moving appropriately, which is very, very common, until you change that thing is just going to keep coming back and biting them.
Absolutely. And when we get into a standing position, for the factory worker, trying to find the right position where they're standing, not just for exercise, but generally standing properly. How many of us go into a sway back posture where our ribs sort of collapse behind our pelvis a little bit?
Yeah.
Or how many people go into the gorilla posture where they're sticking their butt back and they've got a huge lordosis and lock their knees and rotating, head forward carriage and all of this. We see all of these bad postural positions, but if you tell them to, stand up straight, if you just say stand up straight, what they think is straight is horrible oftentimes.
Well, and it also may be really painful.
Right.
Because they don't have any of the strength or endurance to hold that. And it also is like, what is straight? They don't have any reference. When you're standing, the only reference point is your feet.
Yep.
Proprioceptively. And the fact that you're not falling over. Like, my feet are on the ground, I'm not falling over. That's all I really know in terms of the nervous system. And it really takes a bit of awareness to go, okay, well, wait a minute. What is straight in this position? What is more optimum for whatever my condition is or whatever my situation is?
I remember I was seeing a physical therapist for my mid-back. I've got a area where TL junction, where thoracic and lumbar meet, two puzzle pieces that aren't perfect, and I was having some instability. Well, when I got to her, I had, in order to avoid pain, I'd become very kyphotic. I had very rounded shoulders, and I've got a little bit of wedging in my thoracic spine anyway. So being a little more kyphotic felt better. It led to more problems, but it took that pain away because I didn't have the muscular strength in order to stand up. And we're talking, this is 15, 20 years ago. But I went to this physical therapist who, she said, well, we need to work on your posture. And I immediately threw my shoulders back and arched my back and lifted up. And she started laughing hysterically. And she says, honey, she said, you're in kindergarten. Don't expect to graduate tomorrow. We're going to make small changes.
Nice.
And it was very true. It was like, okay, all I need to do for today is just don't lock my knees. Okay, just don't lock my knees. Soften my tailbone. Okay, soften my tailbone. So each session we worked on something very small until we worked our way up the spine. And then I began to strengthen, my paraspinals and working on the little bit of thoracic extension to be able to maintain that posture and to be able to stabilize. But it took a long time. And again, people who expect to be able to immediately, boom, good posture, that's something that takes a long time.
You've been presumably training poor posture for an extended period of time. Or many of us, many of our clients particularly, have never thought about their posture. So 30, 40, 50 years later, it is whatever they have made it become through a lot of training. Mm-hmm. Right? Everyday life is training, people. Don't forget that.
Yes.
And so if you've been doing this, holding yourself in this particular way for 20 years, that's 20 years of practice.
Yep.
And as we know, the body is I think of it as a dense medium. Our brain is pretty plastic and elastic and kind of can make changes pretty quickly, at least thinks it can. Our body, not so much. It's like, oh, I really like to be hunched over. That feels better for me. When I go straight, my back really hurts because I don't have the strength for it, right? Step by step. Okay, well, let's just go back 1/4 of an inch. And then let's work on getting some more back strength. Let's come back a little bit farther. So that slow, gradual change and progression towards the better posture is the way to go.
Absolutely. We've talked about standing. We've talked about, posture, and we're going to get into posture. That's a 2-hour conversation in of itself, and we're going to get to that down the road. But I wanted to talk to you. We have about 10 minutes left. I wanted to bring up something that you brought up to me a while back, and it really made me go, I never really thought about this, but it changed the way I was thinking, in that I was trained and have developed a way to train the low back, and I have a method that does work. Again, I got a book. It explains all that. It's called Back Exercise, Stabilize, Mobilize, Reduce Pain. Buy it on Amazon. I make $1 each time it sells. It's fun. But I had a way that I was sort of taught to do this. And yes, I went off book, no pun intended, different times with different clients. But something you brought up to me that it was like, oh yeah, is sometimes you train the core by not training the core.
Yeah.
And it was like, oh yeah, I can train the upper body, which they're not going to have if they're not hurting, I can train the upper body and begin to build some stability in different planes of motion by using dumbbells or whatever, as long as I can find an exercise that they can do, that they can tolerate, that may not hurt them. Even something like a simple row with, a tube or something, that's pulling me forward. So now my erectors actually have to hold up. I call it incidental core training. They have to hold that as they're doing their row. And oh my gosh, suddenly their back is getting stronger, but I'm not really identifying it. I'm not making them do planks and, all of those type of things that people consider more traditional core work.
I think for me, this has been really important. Again, my background is I worked in rehab really for most of my life in terms of being a Pilates teacher within a rehab environment. That's really been my history. And there were a lot of clients where you could not address the back directly. The back was just in too much pain. You really couldn't move it in any position. And it's almost like when you zeroed in on it, it just made the client more aware of how uncomfortable they were.
Yes.
And it really wasn't effective. It's like, oh, I'm in pain. Oh, I'm in pain. Just reminded them of how bad everything was. And they really couldn't get out of that. So for a lot of them, and the Pilates environment was very nice this way because you can, for example, footwork on the reformer. You're lying down on the carriage. You can support the lower back. You can support the neck and head. Everything is kind of stabilized by a pad or the surface they're lying on, and they can just get their legs stronger.
Yep.
And I really found, but again, even getting your legs stronger, if you're doing a leg press, like you do on the Pilates reformer with footwork, you're going to influence the core.
100%.
Again, not you're not going to do a crunch. You're not doing extension. You're going to influence it in a neutral position. And then if you add, let's say you take the straps in the hands and you're doing some arm raises and lowers or whatever, that's going to feed into the whole system of the core. Again, as you said, incidental core work or indirect core work.
Yep.
It's still core work.
Yep.
Right? And it's a really nice way that I found to address people because they weren't worried about their shoulders. They weren't anxious about their legs. They were anxious about their low back. So if I could kind of distract them from the low back too, I could get them stronger without kind of really honing in on the bruise, if you will, right?
Yep. And that's exactly what I was going to say. It's a distraction technique sometimes.
Yeah.
Because if I have them do a pull down, if I have them do a row, if I have them do something, and it could be a tube, it could be a band, it could be anything, it doesn't matter. But getting them to use that upper body, but I'm still having them sit or stand, staggered leg position, whatever. They have to stabilize their body in space. But because they're so focused on their arm, it lessens the awareness to what might bother them. And I'm being conscious of it. I'm watching to see, are they favoring one side? Are they trying to get out of pain? And if they begin to guard, then I can change whatever they're doing. But a lot of times they're just going to do it and they seem to feel better. And they don't know how or why. And suddenly they built more strength in those areas. It's like, oh, and we seem like geniuses, but all it was, okay, you were way too hypersensitive to lie on your back and to do this because your brain was just freaking out. Oh, let's do something else.
Yeah, exactly.
And suddenly, oh my gosh, this seems to work. And then after it feels better and they've calmed down a little bit, then you can say, you know what, I want to try a type of plank. You're just going to do it off of the wall. It's like a wall push-up. Just lean against the wall. Now take one arm off. You know, something that they're like, well, this is easy. I'm like, well, you don't realize you're doing a plank, which would have hurt you before. And then it's like, okay, let's gradually progress into it. And they're like, oh, I can do this now. And it doesn't hurt. All right. So it's a great way to sort of come back around and begin to train them in a very indirect, you know, that indirect incidental core there where they're not focused on it. They're focused on something else. It's a wonderful way to do it.
It's yeah, exactly. It's a way of changing their perspective and changing what they're focusing on. The other thing too I find is a lot of the work that I do, that like standing band work, for example, right? Or on the reformer standing, pulling the strap, or, you know, the tower or whatever, pulling the straps. They're gonna have to work on posture. They're gonna have to work on strength. They're gonna have to work on stability. Mm-hmm. But without moving the spine. So it's the distraction issue. It's like I'm thinking about something else, which is often really, really helpful all by itself.
Yeah.
And yet it feeds into the whole system, because the low back really is the center of our entire movement system. Mm-hmm. So you're working the lower, if you're working the upper body, you're influencing the thoracolumbar fascia, you're influencing the muscles that feed into the low back. If you're working on the hips and the legs, same thing. Those are feeding up through the glutes and into the lower back.
Yep.
Again, it's indirectness and it's the distraction. A lot of times with low back pain, especially, clients get very fixated on it.
Yes.
And oftentimes, the more they focus on it, the more they identify pain.
Yep. It's their story.
Right. And if you're saying, how does that feel? How does that feel? How does that feel? You know, what is your back doing right now? It almost blows up that feeling of pain and exaggerates it. So very often it's like, okay, we're gonna do a little bit of here. Now we're gonna do something else. And I really have them focus on what your shoulders feel like, what your hips feel like, what your feet feel like. Like, think about some other part of your body.
Yep.
Just as a psychological change from what they're focusing on.
Something else I find with clients, and this is another version of distraction, and then we'll probably begin wrapping things up. I'll keep them talking about something else.
Yeah. Yeah.
About something else entirely different. And what you find is it's hurt. And then you say, well, how are your kids? Oh, they're doing great. Da, da, da. And all of a sudden their face relaxed. They're still doing the exercise, but their whole body has relaxed because they're no longer focused so hard on that, you know, that low back pain, you know? And it's not until they stop talking or you ask them and they go, oh yeah, it hurts a lot. And I'm like, well, it didn't hurt a second ago. You were actually doing pretty good. I don't bring this up to them. I notice it, you know, because you can't. Yeah. But it's one of those things I notice it. I said, okay, I know I have to keep them distracted. I know I have to keep them talking. I have one client who talks nonstop from the time she opens my door. And I will maybe, besides saying, okay, one more, three more, except for cueing, I might get in 5 words. And it becomes a running joke in the studio because, you know, other people will say, oh, you actually said a couple sentences to her. That was amazing. But she's not focused on her pain. So you know what? Let her do it. Yeah. She's very almost hypersensitive when it comes to pain. So that's another way that you can distract. As long as they're doing the exercise correctly and you can get their mind off of it, it could really help.
Nice.
All right. Well, we have literally scratched the surface for low back pain. We have barely, I mean, this is going to be the biggest onion you could ever imagine. And we've literally taken one tiny little layer off the end. We're going to do a lot more podcasts, you know, sessions on the low back because there's so much to dive into, so much we can dive into, and so much we can work with when it comes to not only exercise, but different conditions and all of that. So we're going to be doing a lot more in the future.
And we hope this has given you just some thoughts. A lot of times when we think about these podcasts or I'm thinking of them as little thought seeds. Yep. Just little things to throw into your brain to go, maybe I should try the indirect approach. Maybe I haven't asked that client how long they can sit. So maybe just put some seeds into your brain that will hopefully sprout and just help to give you an answer to a problem that you're having at the moment. That's kind of our idea with a lot of these podcasts, is just giving you some thoughts to focus on.
Absolutely. And if just one of these ideas helps the next client you're working with, it's been worthwhile.
Exactly. Exactly. So, yeah, thanks for joining us, you guys.
Thanks for joining us. We are Nora St. John, Brian Ritchie. We are Moving Conversations, and we will see you again next time.